Hello everyone. I'm going to demonstrate how to take on and put off a N95 mask. So I wanted to say before I get into this that at CVS we normally would not ask you to wear an N95 mask when you're supporting the individuals that we serve. We would only be required to wear an N95 mask if you're supporting someone who has potentially COVID-19 or is coughing or has some other respiratory illness. The reason behind that is N95 masks, which is what this is, are typically worn by healthcare workers when they're interacting with someone who has some type of respiratory issue, including COVID-19. So this is what most healthcare workers have been wearing throughout this pandemic. So one, we want to reserve the use of it for only when we need it, but also we want to make sure that, we're not making you wear personal protective equipment that's not really necessary, depending on the hazard. However, there could be instances where you may have to wear this N95 mask. So I'm going to show you how to accurately put it on and to take it off. So before I get into that, what I want to do is I want to show you some of the features of this mask compared to other masks that you may have seen. So in comparison to a reusable face mask or a disposable face mask, you will see that the straps for this N95 mask are above and below the mask, whereas other masks will usually have the straps beside. And you'll see why that's the case in a moment when I demonstrate how to put it on. You'll also see that the N95 has a nose piece right at the front that basically fits along the nose of the person who's wearing it. And the point of that is to create a big seal around the face of the person wearing it. So we're trying to create a very tight seal where no air can really escape, and no air can really get in at the same time too. You'll also see on the inside of the mask that there is a piece of foam here, and again that's to create a bit of comfort for the person who's wearing it, because again, a healthcare worker might be wearing this for a number of hours. We want to make sure that they're able to feel comfortable, that they won't have to adjust the mask quite a lot, and it's important that those features are there in order for it to be effective in what it's trying to do. Okay, so first things first, before we put on any personal protective equipment, we always wash our hands. So we're going to wash our hands 20 seconds with soap and water, and then we're going to dry our hands. Okay, and one thing that's really important when we pick this up is, like, again, we're going to try our best, even though our hands are clean, we're going to try our best not to touch the inside of the mask. The reason being is that we want to get in the habit of trying to avoid that. So we want to hold the mask by the sides, or in the case of this mask, we're going to probably make most contact with the front of the mask, and you'll see why in a minute. So what we want is we want the straps to be dangling. We also want the straps to be in front of the mask. So you want your hands to be cupped behind the mask, okay? That's how you should be positioned before you put this mask on. Then what's going to happen is you're going to angle your chin into the bottom of the mask, and then you're going to put it over your nose. So that's how it should look right now before we start putting on the straps, okay? Then what we're going to do is we're going to take the top strap and we're going to pull it just above our ears. Okay. You can see that, I think. Yep. And then we're going to take the bottom strap and you're going to hold on tight, because the mask might want to move, but you're going to hold on to the mask tightly, and you're going to pull this strap all the way over your head onto the back of your neck. Once the strap is behind your neck, you're going to untangle the straps to make sure that they're all nice and stable. You'll see, for me, because I have a pretty small head, that the mask is now kind of risen up. So what I'm going to do is I'm going to go and I'm going to take my mask. I'm going to kind of adjust it so it's nice and comfy for me. Once we have the right position, what we're going to do is we're going to take our 2 index fingers and we're going to push down and outwards to create a fit around the nose piece. And this is the key to creating a tight seal. Okay, so once we've done that, then what we want to do is we want to do a fit test. And with the N95 mask, a fit test is actually a requirement in wearing this. So healthcare workers who are wearing this all have to do a fit test to make sure that it's accurately put on. So the way to do the fit test is we cup our hands over and we exhale. And what we're looking for here is we want to make sure that there's no air that's escaping across the sides. So for me, everything is staying within. It's been fit properly. If, for instance, you feel that there's any air escaping, you want to push down further on the nose piece, or you want to move potentially the straps tighter around. You want to move everything around to make sure that, again, when you do the fit test, that no air is escaping. So this is how it's going to look once it's done. After we put on the mask, again, it's good practice to wash our hands. Okay, 20 seconds, soap and water, and dry our hands. Then you go about your time in the mask. After you're finished, then it's time to remove the mask, right? Correct. So we're going to almost do a bit of a reverse procedure, but it's important to see how that looks, okay? So first thing that we're going to do is we're going to cup the mask here. We're going to take off this top strap first, and we're going to pull it over. I'm going to hold it out in front of me. Then what we're going to do, excuse me, then what we're going to do is I'm going to remove the second strap here. And the mask is now in front of me. And because this is a disposable mask, we're going to take it and we're going to throw it out. Once it's in the garbage, we're going to wash our hands. 20 seconds with soap and water. And then we're going to dry our hands. And then we can go about our day. And that is how to properly put on and take off an N95 mask. I hope you found this useful and stay safe. Thank you.